Hello, everyone, and welcome. I am Sally Davies, an editor at Eon Magazine, and it is my pleasure to welcome you to today's Brocher Meetup on wellness culture and health misinformation. So, just a few quick words of housekeeping. We're going to spend a bit over an hour together. I'm just going to say a few brief words to frame the discussion. The panelists will then introduce themselves and offer some presentations, and then we will open up the discussion for conversation and debate. So questions from all of the attendees and participants are very welcome. So please do feel free to use the Q&A or the chat. One of them is always turned off and one is on. I can't recall which, but one of them will be accessible to you to direct conversations to the panelists directly. So to the subject of today's conversation, here's how I understand the puzzle at the centre of it. We live in a moment of extraordinary access to medical knowledge with more clinical evidence, public health data, and peer-reviewed research available than at any point in human history. And yet, alternative health paradigms are not retreating in the face of all this evidence. On the contrary, they seem to be advancing, gaining cultural prestige, commercial power, and political influence. It might be tempting to treat this as a simple supply-side story about bad information displacing the good, but the picture is considerably more complicated. There is a burgeoning demand for health information too, so understanding why misinformative content is compelling and not just why it's wrong seems essential to any serious response. So three dimensions of this inquiry seem to me to deserve particular attention today, although our panelists can correct me if I'm wrong about any of this. First, there's the economics. So health information is not simply an accident of the information age. For many actors, it's a business model. This goes from supplement sellers to wellness influencers, and the platforms that host them. The reality is that misleading health content generates revenue. So understanding who profits, how, and why is essential to understanding why the problem is so resistant to correction. Second is the platforms themselves. The digital environments where most health information now circulates were certainly not designed with public health in mind. They were designed, as many of us know, to maximize engagement. And it turns out that emotionally charged, identity affirming, and counter-institutional content is very engaging indeed. The question of how platform affordances shape what health information people encounter and what they do with it is one that researchers are only now beginning to grapple with seriously. Thirdly, and perhaps most uncomfortably, is the question of what health misinformation reveals about us. Health is where our most intimate anxieties meet our deepest frustrations with institutions. The appeal of alternative narratives may therefore tell us something important about what mainstream medicine and public health are failing to provide, whether that's agency, dignity, meaning, community, or simply the time and attention that an overstretched doctor cannot offer. So I'd like us to resist today the impulse to treat health misinformation purely as a problem of ignorance or credulity. The harder and more productive question, it seems to me, is what social, political, and economic conditions have made this material so powerful and what the diagnosis implies for the remedy. So with that, I'm going to ask each of the panelists to introduce themselves. Marco, would you like to join us?
Hi there, my name is Marco Zanoni. I'm an assistant professor at the University of Ottawa, where I study medical and public health mis and disinformation. As alluded to, a lot of my research looks at digital platforms and their role in amplifying the disinformation economy.
Thank you so much, Marco, for being here. And Martha.
Hi, I'm Martha Lincoln. I'm a medical and cultural anthropologist at San Francisco State University. My work currently addresses the phenomenon of online health and wellness influencing.
Thank you so much. It's wonderful to have you both. I think we're going to hear from Marco first with a brief presentation followed by Martha, and then we'll open things up for questions.
That sounds great. Confirming everyone can see my screen. Okay, wonderful. Well, thank you for the introduction and thanks for having me. And thanks also to Dr. Lincoln for inviting me today to speak with you all. My talk is going to be sharing some things about mis and disinformation that I think you ought to know. I think we talk a lot about mis and disinformation as very much an individual problem, where it's a specific person's problem to deal with. But I think we should go upstream. So I'm going to share some key lessons I think are helpful to move us from this individual lens on misinformation to one that's a bit more structural. So the first key message I want to share is that we often mean disinformation when we're talking about misinformation. So what I mean by that is a lot of the misinformation in our world, whether it's vaccines or other health topics, usually has some kind of disinformation origin. So just an example of this, there's a lot of talk right now about vaccine misinformation and disinformation, especially around measles and the MMR vaccine. If we peel that back, we can see that this very easily has a disinformation origin in the very notorious Wakefield article, which very much fraudulently linked the MMR vaccine to outcomes like autism. And this was, of course, it caused a lot of harm. Wakefield later lost his medical license for this deceit and what people refer to as his callous disregard for children. We see this disinformation continuing through groups like the Children's Health Defense, which was founded by the current US Health Secretary, Robert F. Kennedy Jr. Again, just kind of showing if we peel back the curtain, a lot of this misinformation has this disinformation origin. And why this is so important is if we treat false information only as misinformation, somebody believing that vaccines are harmful is the problem that we have to, fix. And the thing that we have to focus on is changing their minds. We're very much individualizing this problem, and we're diverting attention away from the very often powerful actors who deliberately manufacture and often monetize this disinformation. The second key message I want to share is that disinformation is usually highly profitable. There's no, shortage of examples of the ways that dis and misinformation is monetized. We see digital profiteering by anti-vaccination actors. We see different kind of organizations that exist to share misinformation, making money through those means. But we also see groups like digital platforms making money through these sorts of business models. A lot of my research focuses on digital platforms and how their tools are used to amplify public health and medical disinformation. And a specific interest of mine is when somebody's in a really hard spot with a medical diagnosis like stage 4 cancer or debilitating illness where nothing can be done for them, how people try to exploit them. So I've done a lot of research in this space looking at how tools like Google Ads, Meta Ads, Google reviews, and really any kind of online informational space can be used to exploit folks in these hard situations. Again, making a lot of money for disinformation actors who do this exploiting. We also know by now that disinformation is becoming part of the social media business model. Whether digital platforms set out for this to happen or not is debatable. I don't think that's what they intended to do when they started, but it has become part of how they make money. As the that was alluded to in the introductions, digital platforms make money by keeping people on their platforms as long as possible so they can show ads. So anything that they can do to keep somebody on the platform is profitable for them. And some of the most engaging types of content, unfortunately, is those that provoke fear, those that provoke outrage, and a lot of intense emotion, which disinformation and misinformation tends to do. And as we see this happening, where digital platforms are becoming arguably the greatest conduit for mis and disinformation and for folks who do a lot of disinforming or kind of deceptive practices, we see groups like the WHO and TikTok collaborating, or Facebook and other leading health organizations. I view this very much as a paradoxical situation. These are digital platforms that are profiting from mis and disinformation, in my view, quite actively, but they're partnering with different institutions, and those institutions are expecting them to help solve this issue. Does it make sense when we look at it from that perspective? My colleague and I, Nora Kenworthy, we wrote about this not too long ago, about asking this question, whether groups like the WHO should partner with digital platforms to combat misinformation. And we argued that, of course, we can't not use digital platforms, but the way we do that kind of engagement with them is so crucial to make sure it's appropriate. And some of the key lessons that we kind of pull out from this article is this point that we sometimes in public health forget that platforms are not neutral entities. They're very much businesses that have a different fiduciary duty or a different motive than public health. So it's a bit naive to think they're altruistically going to model or change their business model because we ask them to, or because of these problems of mis and disinformation. Partnerships also endorse what digital platforms are doing without if whatever initiatives they're taking right now to combat misinformation. And they're usually quite surface level in the form of giving ads, things like that. But they don't do anything to change these more structural elements. At its core, though, this really is an issue of power. I understand why groups like the WHO would partner with TikTok, mainly because they have to. there's very little incentive or power in the public health community or from groups like WHO to actually do anything in the online space unless we just ask, because we don't have that power to make any other changes. And while all this is happening, you think, digital platforms would, hopefully try to meet the moment we have with mis and disinformation. But unfortunately, I think it's actually going the other way. We see a lot of the biggest digital platforms like Meta cutting their fact-checking programs, and big tech across the board cutting their trust and safety teams. And that brings me to my next key message, is that studying and researching disinformation is coming with real risks now. We see groups being sued by Elon Musk, for example, for doing research that's a bit critical on digital platform content. We've seen very prominent researchers like my former mentor, Professor Timothy Caulfield, receiving death threats, being sued, or being lied about. In my view, honestly, I think he's been defamed by many different people for his work in studying and combating or debunking misinformation, rather. And we also see disinformation researchers under investigation in places like the US through political means, which is a very uncomfortable position for those who study disinformation to be in. And my biggest worry with this, and why I think it's a key point, is I'm worried that there's going to be a chilling effect on the types of questions or the types of research we do, because it's just becoming so uncomfortable for folks who do this research to exist in this space. Most senior researchers feel, this kind of discomfort. For the more junior folks who are just coming in, PhD students, graduate students, it's a very intimidating place to be when there's a very real risk external to them. My next key message is that it's also becoming harder to study mis and disinformation. And what I mean by this is it's harder to get data, and it's becoming more restrictive. So just to give you an example of this, if I wanted to study some content or what's happening on TikTok using the TikTok API or the research tools, I have to agree to these conditions before I get access to that data. That includes giving access to TikTok to a copy of my manuscript before I publish it. I have to disclose the intent of my research before I receive the data access. And I also have to agree for them to basically monitor my use of their tools at any time without them letting me know. As a research setup, this is highly inappropriate, and also just not going to lead to the best outcomes. If we're doing research that's somewhat critical of these platforms, with the platforms themselves being the gatekeepers to the data, there's no really incentive for them to share that data with us, but it also makes it very hard for us to figure out what's happening on these platforms. We also see digital platforms retreating from some of the tools that they did provide, like, for example, Meta getting rid of CrowdTangle, which was a tool that was used to track this information, with kind of diluted versions of these tools. In Canada, I know this is a very broad audience we're speaking to. I think we're falling behind on this. There's very little data access that we're guaranteed to in Canada. It is great to see folks like the EU, for example, though, under the Digital Services Act, making sure that they have access to at least some data to make sure these online spaces can be at least monitored for safety. My next key message is that terms like infodemic hold us back. For those that don't know, infodemic is an emergency term. It's used to basically say when there's a lot of misinformation spreading about a specific topic at a specific moment in time. But we're using it very much as this catch-all phrase. And there's been a lot of great writing on this, like from Dr. Tina Purnett, which helps advance how I look at these issues. A better frame that we can adopt that goes from this idea of an infodemic is one that more looks at the information environments as structural determinants of health, and ones that look at all levels of our information environments and how they're created, involving groups from politics, law, economy, media, education, science, the whole sphere of how these information environments are made and governed. And this is just another way to say that we have to stop blaming individuals for mis and disinformation and start looking at symptoms, or systems rather, excuse me. My next key message is that mis and disinformation issues are not new. I love this slide here because it talks about this idea that there was opposition to the idea of vaccination before vaccines even existed. But we often think of mis and disinformation as very much a recent crisis, whether it's from the 2016 US presidential election or from the COVID-19 pandemic. But mis and disinformation, it's been around since all time, honestly. And I think while we talk about this moment we're in as very much a unique one, I think we can look to history to inform our approach and how we deal with misinformation right now and into the future. I also think we should start looking at the history of the disinformation playbook and start talking about topics that aren't necessarily just vaccination, but the other kinds of mis and disinformation we've seen in the public health literature and history. Some of the more notorious examples of this, of course, are the tobacco industry, who were the original manufacturers of doubt and denial, who, through internal documents, we knew that they created controversies in order to protect their product when they knew it caused things like cancer. We see this for other industries who have learned from the tobacco industry as well, like the opioids, from the pharmaceutical industry, as well as many other industries like the formula industry for babies, cigarettes, pharmaceuticals, asbestos, ultra-processed foods, and fossil fuels, who have all learned from this experience of the tobacco industry and their disinformation playbook. I think we should also start looking at mis and disinformation as less than just saying something is not true and amplifying that message, but also start realizing that there's very sophisticated strategies that are used to disinform that are much more than just, again, propagating an idea that's not true. It can be things or different kinds of strategies like intimidating and vilifying critics, attacking and undermining science, framing and reframing discussions and debates, and many other things that are employed by the corporate playbook. And a really helpful perspective that we can use to understand this is the commercial determinants of health, which really look at the role of commercial actors in shaping different kinds of health outcomes. And this is kind of a bridge on the social determinants of health, but really acknowledging that that commercial sector has a role in shaping social determinants. My next key message is that mis and disinformation harms are inequitably distributed, and this is often exploited. Bad actors often manipulate feelings of mistrust for their own gain. This includes some horrible examples like equating the Tuskegee medical experiments to public health campaigns encouraging vaccination in Black men. This is just one example of a documentary that does that. These really horrible atrocities, again, to undermine current public health initiatives. I also just want to flag as well, when it comes to digital platforms, the safety we have when it comes to disinformation and misinformation, the moderation that we have is very much focused on the English language right now. And mis and disinformation in languages that aren't English, the challenges there are even worse than those in English. My last key message is that we are not going to educate our way out of the mis and disinformation crisis. Oftentimes we see as a response to mis and disinformation the idea of debunking or kind of competing with misinformation with the truth. And this somewhat promotes this information deficit approach where if we can give them the real truth, then they won't believe the disinformation. That's just not how this works. We see a lot of initiatives from governments, like these examples from Canada. These ads, I don't want to say that they're bad. Like, this is good, and I encourage it. But this cannot be the only intervention against mis and disinformation, because the ecosystem that is allowing misinformation to thrive doesn't change here. Education campaigns also do not address the broader social conditions which allow misinformation to often thrive through existing inequities. Also, this idea of producing content to compete with misinformation or disinformation. In the age of AI, this isn't going to be effective. We're going to see an overload, if we haven't already, of misleading AI-generated imagery, videos, and text. So we can't move forward with this idea that we're going to out-educate mis and disinformation actors. Some other quick things that I think are important to know before I end my talk is avoid the trap of overt misinformation. Oftentimes we get drawn into debates whether if something is true or not, like is climate change real or not. The most harmful disinformation happening there is not if climate change is real or not, but it's what we do about climate change or what's possible for us to do about it. Watch out for mis and disinformation by omission. A lot of times there's factual statements where key context is left out. A little controversial, but I think we need more political economy research and less psychology research in mis and disinformation. I think if we describe a lot of mis and disinformation issues in the terms of psychology, people believe misinformation because they have X attribute. I don't think that gets us anywhere. Mis and disinformation is intensely political, and I think we see this as a reflection of many different information environments and political environments. Essentially, also, not knowing something does not mean that somebody believes this is misinformation. I see a lot of research equating this idea of not knowing something, and they present this as someone believing mis and disinformation. Last at its issue, excuse me, last at its core, mis and disinformation is very much an issue of power. Thank you very much. I'll hand it over to Dr. Lincoln, and I hope I didn't take too long. Thank you.
Thank you, Marco. That's fascinating. Martha, over to you.
Thank you so much. Thanks everyone for being here. It's wonderful to see everyone. Thanks so much to our friends and colleagues at the Brocher Foundation for allowing us to connect here for this conversation. And thank you so much, Sally, for facilitating for us. We're so appreciative. Marco, thank you for those wonderful clarifying framing remarks. Some of what I'm about to share will articulate, I think, generatively with what you've just given us to think about. I'm going to begin just by saying a little bit about my current work and my more recent work as well. I'm a cultural and medical anthropologist, as I said. And in the last 5 years, I've been working on topics related to the cultural politics of the coronavirus pandemic in the United States, where obviously concerns about misinformation and truth provoked a great deal of debate. And at the same time that I was doing that work, I had a concurrent project on the way that emotions circulate as part of online crowdfunding exchanges. So I'm broadly interested in digital culture and in cultural politics in relationship to health and medicine. And I see these issues converging in the phenomenon of online health and wellness influencing, which again is the subject of my current project. To say a little bit about this phenomenon, I think folks are probably familiar, but social media influencing is defined in different ways. Broadly, it is a practice of digital communication where actors seek to establish credibility, legitimacy, and engagement at a large scale in online attention economies. And though influencing is sometimes dismissed, maybe for reasonable reasons, as a superficial popular culture phenomenon, these practices are increasingly consequential. And health and wellness issues are maybe a particularly dynamic part of the world of online influence. It's also noteworthy, just speaking to the issues of supply and demand that Sally flagged for us, that over half of American adults, US adults, use social media to source medical advice and information currently. So addressing this demand, influencers generate and share digital content on health and wellness topics really across the board, on topics like diet and nutrition, fitness, mental health, pediatric health, reproductive health, sleep optimization, longevity, and many, many more. And this kind of material can be found on essentially every social media platform, including some that is, as Marco mentioned, AI generated. However, not all online material about health is misinformative. Some health influencers are actually credentialed professionals who use social media as a means of educating and informing the public. So one can find highly followed accounts on Twitter, TikTok, Substack, etc., that belong to epidemiologists, oncologists, ophthalmologists, family physicians. There's like a long list of folks, some of whom are quite well known for their short form video, their blog posts, their newsletters, their commentaries. And some of these folks use social media specifically to identify and debunk misinformation. This became a more sort of popular and attended to practice, especially during the coronavirus pandemic, I think. But at the same time, facilitated at least in part by the light regulation of social media platforms in the US and elsewhere, and there lacks content moderation and self-policing standards. Other social media users have a lot of freedom to communicate about health in ways that are less evidence-based, more heterodox, more conspiratorial, more commercial, and more misinformative. And again, these are folks who are found on essentially every social media platform, sometimes endorsing perspectives that are essentially benign, and in other instances, advocating therapies and lifestyle choices and practices that are actively unsafe, such as, for example, using unregulated substances as medicine, adhering to restrictive diets, consuming unpasteurized milk and other unsafe foods, or declining medical interventions during pregnancy and childbirth. And this obviously poses real difficulties for public health. As Marco was suggesting, experts often seek to counter misinformation by showing it to be erroneous, including on social media platforms themselves. Yet some claims cannot readily be dispelled by fact-checking, especially when audiences find these claims, or if not propositional claims, suggestions, to be emotionally or ideologically resonant or to speak to certain unmet needs. So health influencer often gains traction with groups that feel alienated or harmed by mainstream medicine and its institutions, and this makes debunking or pre-bunking interventions much less effective. And because social media provides such ready access to advice and information that can indeed seem useful and credible, groups that are medically underserved are at particular risk of seeking out and accepting influencer messages. Further, very importantly, I think in our current moment, at least in the United States, and maybe with some spillover or like similar effects elsewhere in the world, online health misinformation is not a fringe phenomenon currently. Um, it is certainly not best understood as an issue of individual bad actors. And increasingly, what we're seeing in the US is that not only do social media platforms themselves contribute to these dynamics, creating an environment of misleading or untrue, material, but more broadly in the US, there's a weird crossover taking place between the world of online health influencing and the world of government, state officials, and public institutions, with disinformative or misinformative or malinformative tropes and narratives generated and disseminated at the highest levels of government. And this is happening in multiple places. The MAHA, or Make America Healthy Again movement, is deeply steeped in social media influencing, and a number of its highest placed officials are themselves online influencers. Mehmet Oz, who heads the Centers for Medicare and Medicaid Services, was a television doctor for many years. He has over 1 million followers on his personal Instagram account. Casey Means, the current nominee for US Surgeon General, lacks board certification in medicine and is probably best known for her also highly followed Instagram account and her self-published digital newsletter that promotes fringe ideas about metabolic health. RFK Jr., who is the Secretary of the Health and Human Services Department currently, routinely creates short-form videos of personal workouts or supposedly healthy meals as part of his efforts to promote the MAHA agenda. And the official social media accounts of all of the departments of health under HHS have posted in the last year untrue claims and misleading material. Claims that frame issues, for example, in terms of, and this is like to speak to the important point that Marco raised. So for example, there's been a lot of chatter in these federal agencies about a supposed war on healthy food or a war on real food. That is a misleading framing. There's certainly much to discuss about the politics of food in this country, but the MAHA frame that's being propagated on social media is highly tendentious and misleading. So in my work, I'm interested in tracing how online influence and official institutional power in this country have become intertwined and cross-pollinating. Essentially asking, what do these digital practices which are typically historically used by outsiders with very little formal power. What are these practices doing for leaders and organizations who have so much real power at their disposal? And how does the Trump government's health agenda draw influence and legitimacy from its participation in online attention economies? This is probably plenty, so let me stop here. Again, thanks so much. I'm looking forward to questions and discussion.
Thank you so much, Marco and Martha. Lots to discuss. I want to open actually with a somewhat naive question, beg your pardon, which is, Marco, you started your presentation by talking about this distinction between mis and disinformation. I was wondering if you could just flesh that out a little bit more for us.
Yeah, absolutely. Misinformation is any kind of false information, whereas disinformation is false information with some kind of advantage that the person who's spreading that false information gets from its dissemination. Disinformation is usually focused on this idea of intent. Some of the more recent work I've seen kind of criticizes this definition of intent. It's hard to prove somebody's actively deceiving somebody. I think we can consider disinformation, of course, to include intent, but it can also include conflicts of interest that are irredeemable in the spread of false information.
Yeah, so is that sort of following on from work that's been done analysing the effect of disinformation in the tobacco industry, climate change, and sort of taking that model and saying this is also applying to health information? But other scholars seem to criticise and say there might be other motivations that actively encourage you to disseminate false information that don't necessarily require you to be consciously aware of your own motivation caused by conflict of interest.
Yeah, I think it's kind of like a disinformation by ignorance or like a choiceful ignorance in some
Mm,
ways.
interesting. I mean, when I was preparing for today's discussion, something that really struck me was how when you enter into the space of these wellness and health influencers, like a lot of the misinformation doesn't actually look like misinformation. It kind of assumes the mantle of empowerment or self-care, like do your own research, listen to your body. So how is it that we can disentangle the kind of useful or at least innocuous parts of these messages from the harmful ones?
You want to take that question, Martha? And
That's a
then I
really
can
good
go in
question.
after. Yeah.
Yeah, let me try. I think it depends a little bit, maybe in part, on who we references, Sally. I think if you mean for our scholarly purposes, how can we critically, read those different elements of an influencing message apart? Um, I think you already have sort of laid the groundwork in your question for like a smart way of doing that, noting that there might be positive or beneficial or harmless elements of somebody's communication where we emphasize empowerment or self-care. And on their face, those are positive pro-social things to note. But in the same message, we might also notice more concerning or even disturbing content that inclines a viewer towards more uh, conservative ideas about the family, for example, or towards unproven medical interventions that might have consequences for some audiences. So I think your question, in a way, points to the really perspectival quality of conversations about misinformation in the first place. When we're talking about misinformation, we typically are speaking as experts to other experts or to others whom we believe will be on board with our judgment that a certain kind of communication is wrong, false, or not factual, right? But if the we you mean is like a broader we, like the average person, then I think things get a lot murkier because this is content that is, I think, not necessarily designed to be consumed very critically. Um, there is not a great deal of, scaffolding or kind of critical context surrounding social media messages. And I think in those ways, misinformative content can be very seductive for the kinds of appeals that you're mentioning. I think especially messages about self-care, for example. In US society where people, have so few resources to feel cared for, we have such poorly functioning public infrastructure. It's really easy, I think, to convince a mass audience of just about anything if you wrap that ideological core in a message about, being better, being fitter, living longer, being more empowered, or, taking care of yourself.
It's really
Yeah,
interesting. Oh, sorry, go on, Marco.
sorry to interrupt. I was just going to add that wellness is very much a kind of framing that puts the onus on somebody to be responsible for their health versus their broader conditions. So those, a lot of the messages are very powerful in that they can say you're responsible for this. It's empowering because they can do something about it. But again, it kind of misses the mark on what actually contributes to our health in many ways. But the wellness industry, they do a really good job at making people feel bad for not doing things. And that kind of um, you know, not great uh, kind of framing. It can make people feel very bad about how they're acting about their health, the choices they make, and lead to some bad consequences.
I guess, as you say, though, there's something very alarming as a consumer to think, well, my health is a byproduct of these deeply suboptimal systems in which I'm embedded. It's much more psychologically reassuring for me to think that it's something I can have agency over when the world seems to feel like more and more overwhelming. And Martha, I think you're right to push me on kind of disambiguating these two audiences, because a question I wanted to put to both of you was concerning the fact that there's a broader political context for this conversation, in the sense that we are obviously living through a populist revolt against expert authority generally, in politics, media, science, and medicine, of course. And, you know, I'm curious about the extent to which um, the response from professionals and scholars and policymakers to kind of lean on this language of misinformation, that sort of goes hand in hand with this idea that the public is being misled, they need to be protected from bad information, platforms need more policing. But is it possible that framing itself could inadvertently contribute to the problem and be perceived by ordinary people as elites kind of being upset about losing their monopoly on information power? Because it is sort of a framing that potentially makes people feel talked down to by institutions. So I guess I'm just curious about whether both or either of you think that the instinct to reach for more gatekeeping or potentially other forms of interventions might actually deepen the alienation that is the thing we're sort of trying to fix.
Yeah, this is a wonderful, wonderful point, and I think so fruitful and important for a broad consideration in conversations about, what we're calling misinformation. I think you are really right, Sally, to suggest a concern around whether it could seem patronizing or paternalistic or like an extension of the nanny state for, you know, state-aligned or non-governmental organizations to be trying to act as some kind of intermediary between, probably possibly harmful information and a public that we see as uncritical or unsophisticated. Um, there have been some really interesting publications in the last few years suggesting the importance of a more sympathetic and compassionate orientation in scholarship about these dynamics. And I think that is really salutary. I think it's really important to ask, as Marco suggested, and I think you suggested this too, Sally, like what kinds of structural drivers are making, a platform like Instagram seem like the best answer to somebody's serious health concerns? Um, what kinds of pressures are making, narratives that we maybe with some critical distance see as conspiratorial seem so alluring and, somehow rewarding to certain kinds of audiences? I think those are good questions to ask. I also think it's really important that we maybe consider the the concept of accompaniment, which is used in medicine, certain kinds of progressive traditions in medicine, um, maybe notably associated with the work of medical anthropologist and physician Paul Farmer. emphasize the idea that patients must be accompanied through systems and on their experience of illness and treatment and care. And we can't expect people to go through these hard situations alone. So we want to have an ethos of accompanying. And I think that this is a really maybe nice way of reframing the impulse to like fact check and correct and protect, asking instead, like, how can we partner with communities such that they are able to be, you know, well informed and to experience like a sense of mastery over their destiny, not just be provided with correct information according to, a class of people they see as elites.
Yeah, and just to add, I think Martha covered that really well. Um, you know, fact checking is just one tool. I think in, getting people information that they can act on that they find useful. But it can't just be the in isolation. I think the broader structural determinants really is what we see fueling a lot of resonance and why people, are attracted to a lot of these more misleading messages. Um, I also just wanted to bring this idea of trust in like, institutions and things like that. I know we've talked a lot about, US politics and stuff like that. I'm from Canada, so just a different perspective from me. But we hear all the time like, oh, we've lost trust in our institutions, we've lost trust in, academics, we've lost trust in physicians. I don't really subscribe to that idea, if I'm honest. I think this is very much kind of like, in a way, almost like an AstroTurf campaign against a lot of expertise that makes people think that. I don't think in the minds of the public that's true, though. I think, we've seen surveys like the Canadian Medical Association survey showing that a lot of people still have really high trust in scientists and physicians, maybe less so in politics. But still, a lot of our institutions, like the CBC in Canada, are well respected, well trusted. So I think sometimes we have to be careful when we're saying that we're losing all this trust in these institutions that are so important.
Yeah, that's a really interesting claim, actually. I'd have to fact check because I'm now asking myself whether, yeah, have I been subject to a disinformation campaign? I mean, my understanding was that there was growing evidence across like Western democracies that there was, at least in some areas, maybe not with medical professionals, for example, but with certain elites or experts, that there was a decline in trust. But I'll have to go away and fact check that for myself, Marco. I did want to
Yeah.
pick up on your point about, the very important and salutary point about looking at misinformation and disinformation through the lens of kind of structural explanations. And the idea here being that this sort of misinformation thrives because of broken healthcare systems, predatory platforms, and legitimate grievances about mistreatment. But then I guess I just worry that where do we go from there? Because it feels like if the underlying problem is capitalism, that's going to be a kind of generational project to fix, might take decades. But of course, people are making dangerous decisions about their health right now based on these ecosystems. And so, does this structural diagnosis, however correct it might be, kind of risk becoming a sort of council of despair that makes short-term interventions inadequate? I guess I'm curious about your response to that.
So I don't uh, before I say my comment, say mis and disinformation is absolutely such a problem, like massive scale problem. But I think sometimes we overestimate maybe sometimes the impact it's actually having across a lot of our institutions. Um, so just as a pre-frame, again, it's a really big problem. But I don't think we have to like make some dramatic shift here. I think this is learning from what these inequities are telling us and how people are responding to different kinds of misinformation from it. We don't have to reinvent the system. We have to just make it more equitable. And ultimately, even though it's not like a specific thing that we can do, there's not going to be a silver bullet situation in this. Anything we could do that kind of, makes our healthcare systems more inequitable, reduces health disparities, is going to help us fight mis and disinformation. Um, I'm not sure if Martha has any comments on that. I know we've had some discussions about it.
Yeah. I think the US is maybe a special case, like especially pessimistic case currently. although I agree with Marco's note that misinformation may not be, um, the scope of this problem may not be quite as it is represented in media. I think there are actually also perverse incentives in media for telling stories about misinformation, um, in like a funny way. Uh, but that said, um, currently, as I mentioned in my prior comments, the way that misinformation is taking place in a kind of economy of scale, in tandem with the activities of the federal government, I think is really concerning. The profit motives are really apparent, and they're very significant. And I think the ability to legislate and regulate around these dynamics in the US will be very limited, at least like in the foreseeable future. Um, Maybe one more optimistic note to strike is that there's activity at the level of states and some coalitions of states to establish new authorities to intervene in public health. And that I think will end up maybe, the internet is everywhere, but I think there may be just a different picture in terms of what the determinants of health look like on a state by state basis, which has been the case historically as well. But I think that those disparities are potentially going to get much deeper in the years ahead.
I
I
have one more thing
Oh,
before we
please go
move on
on.
to the next question. I just want to say as well, misinformation, disinformation, I think we very much should look at them as separate issues sometimes. I think misinformation is, what we've just discussed is a good summary of that. But I think disinformation is this whole other thing that we should be a bit more active in trying to minimize and disrupt these commercial incentives to produce deceptive and deceiving information because it can have really serious consequences. So focusing on like consumer protections that just exist to make our spaces safer, things like that. Tackling really harmful commercial disinformation at scale. Those are things we can intervene on absolutely, versus just this idea of misinformation and changing everything at once.
I'm going to ask one more question before I hand over to some questions that are coming through from participants because they're very pointed and interesting. So I thought I'd bring a kind of case study into awareness that some of you may have come across and that I thought captured some of the dynamics we're talking about, which is the free birth movement. So the Guardian newspaper last year published a major investigation into the Free Birth Society, which was a business, or is, I think, still, I believe, a business promoting birth without medical assistance. And as the investigation laid out, it was linked to dozens of neonatal deaths. So it seems a reasonably clear case of dangerous misinformation, but I think what makes it hard, and the investigation alluded to somewhat, was that many women are drawn to free birth because of like very real experiences they've had, feeling coerced or ignored during hospital births, having over medicalized care, and for Black women in particular, well documented racial disparities in maternal outcomes. So I guess, the case shows that starting instinct that women and birthing people deserve more autonomy and dignity in childbirth is not wrong. So I guess my question is, when we focus on this as a case of misinformation, do we risk sort of sidelining the origins of these ideas and the potentially legitimate reasons that they're appealing in the first place? But conversely, does acknowledging those legitimate grievances make it harder to draw a clear line when things go dangerously far? Just curious for both of your reactions to that instance.
Right. Marco, do you want to go ahead?
Um, I'm okay for you to go ahead if you like. I just
Okay.
have a small thought after.
Okay, I'll jump in and see what I can do with that really important case in question. Um, yeah, so this is a notorious case indeed. And I'm not an expert on this phenomenon, but what I have read and understand also suggests that there's a fairly clear and obvious link between the content that was created by this somewhat cult-like group, through its online footprint and in-person uh, social organizing, and then the really terrible maternal and newborn children outcomes that were recorded for some participants in that group. I think it is so important and unfortunately like so difficult to communicate, but it is so important for the medical establishment and for public health institutions to take note of the association between iatrogenic illness and injury and demand for alternative therapies. There are very few incentives for pointing out this association. And the research that I have seen on that phenomenon of people being, harmed or injured in some way by, a practitioner of traditional medicine and then seeking alternatives, that research comes from anthropology. I'm not sure, it may exist, but I'm not sure that there is medical or public health research attention on that phenomenon. Um, and if I'm right about that, one might speculate, why that's such an unpopular message in those fields. Um, I do think that the institutional failures in medicine and public health in the US are I'm trying to think of a very diplomatic way to say this that won't get me into trouble. Sorry, let me just ruminate for a second. Not at all to disparage the incredible effort that healthcare workers and other health professionals put into what they do. But I think another example, the coronavirus pandemic suggested the kinds of baked in difficulties that we find in our systems that create robust opportunities for people to need and want, a situation outside of that system. And it's very understandable and indeed predictable that some percentage of the population will go in those directions. Uh, Let me stop there and turn it to Marco.
Yeah, I don't think I have too much more to add. Just to say that, situations like the one both Sally and Martha described, they create the conditions for people to be exploited in many cases. Experiences, a lot of my research, for example, is with people who have stage 4 cancer, or, incurable conditions. They have horrible experiences sometimes when there's this handover from more curative treatment to palliative care. And what drives them to a lot of alternative health practitioners is, again, they feel abandoned. They don't feel like, the person wants to do anything with them anymore. But again, this kind of leads this condition for exploitation. And I think something very similar with, I don't know as much about this movement that you've referred to, Sally, but I could see how, very negative experiences can drive people, to these alternative practices. And not always all are alternative practices like, evil or trying to do horrible things like the example I gave with cancer, but it can put people at risk. But also sometimes those industries can exist to, exploit folks in those hard situations, which I think is the biggest concern I have with that.
It's really interesting, Marco, your research with people living with cancer, because yeah, it strikes me that it sort of ties back to Martha, your point about that notion of accompaniment. And it feels to me like this polarity of accompaniment versus abandonment that I've read other research, and in fact, there's a book by the writer Barbara Ehrenreich called Bright-Sided about kind of the abandonment of terminal cancer, people living with terminal cancer by the kind of cancer activism movement, for example, so that you could see potentially, hypothetically, that there are these moments where people feel abandoned and not accompanied, and so these social media ecosystems give them a space where they feel seen and understood and accompanied. I want to bring in some of the fascinating questions coming in from the participants. So Ruth Muller has I'm going to slightly reword what she said here, but what I understand her to be asking is that the way we've sort of talked about misinformation today frames it as something that's kind of entering from the outside of mainstream medicine. But she is struck by the fact there's quite a lot of non-evidence-based thinking within conventional medicine. like a strong immune system means you don't get sick and so forth. And she suggested that this shares something with wellness misinformation, a kind of quasi-eugenic picture of health as an individual achievement that the right body can earn. So I'm curious to hear from Martha and Marco, are there any continuities between wellness disinformation and what passes for established medical knowledge?
Yeah, that's an excellent question. And I taught the sociology of health like 3 weeks ago. So I wish I got that question 3 weeks ago. But the development of modern medical practice it was built with a lot of things that didn't work. And again, I caution on this idea of not knowing something equating to being misinformation. But I take the point. I think within medical practice, within kind of current knowledge systems, there are problems there. And I don't think that's something that's kind of um, almost that we have to think is like a shutdown. Like I think it's just kind of what it is, and dealing with that and acknowledging it and just moving forward with it. But yeah, even like the time it takes to implement current evidence takes a long time. I don't have further comments on that, but it's a great question.
It is a great question. I'm trying to think of like a great example to connect to the point. I guess I might tack back just for a moment to women's health as it's understood or often, not fully understood by mainstream medicine. There's so many areas of ignorance and variability in clinical best practices around women's health. And this is again, this is one of the, I think, obvious drivers of women specifically into the role of consumers of alternative or less, formally evidence-based therapies. I have to keep reflecting on this, but thank you so much for raising the point.
It's interesting. Could I just ask a follow-up there, Martha, about kind of what do you see in your work about the gender dynamics, whether between men and women as kind of purveyors of or consumers of mis and disinformation? And that probably I'd be curious to hear your response to that too, Marco.
Right. Yeah, what an interesting question. I think so I'm currently collecting data from Instagram influencers, many or most of whom are female. There may be just a few men in my current sample, but one I think um, emphasized thread in the material that I've seen is a sort of an interesting blending or blurring of topics that are properly medical, that we would consider maybe properly medical, with other kinds of related issues that are related more to lifestyle, like family, like the household, like food, like farming and homesteading. All of those things are kind of run together in a way that is often framed as holistic, but in some instances has a kind of conspiratorial quality, like everything is connected, like for good or for ill. Everything we do in our lives, everything that we are, is all part of one kind of strand. I see that as a message that is maybe unconsciously repeated through a lot of the influencing content shared by prominent women who use that medium. Male influencers, I think, maybe tend to specialize a little bit more, sometimes lean more on credentials, even if those credentials are not, kind of officially recognizably medical. Um, the sorts of stories that they tell about what health is or what wellness is maybe articulate with more openly political and ideological issues like freedom and self-determination and autonomy. Um, that's a little bit of a loose read, and I think there's probably more to say about the way that influencing content is gendered in these media. But let me pause there and see if Marco wants to weigh in.
Yeah, not too much more to add. Just to say that I think when we don't know something or we do something bad in medicine and public health, we earn the public's trust when we acknowledge it. When it comes to the messages that Martha was just describing, the gendered elements of them, A really fascinating area, right now is the manosphere. And this exactly how Martha just said, these ideas of like personal responsibility, and like provider this, like all these things. And there's some really great documentaries. There's a new one just released on Netflix, like I think last week. I don't have much to add in I guess to the question, but I think those resources might be a good place to check out how this manifests more in digital spaces.
I'm going to pick up on a question here from one of our anonymous attendees, who says that, well, they're struck by the idea that focusing on misinformation and disinformation as an individual problem can create this presumption that people lack agency and can't be trusted with their own health. Do you think the way that we're discussing this problem risks returning us to a more paternalistic approach to healthcare? That said, I'm conscious that we are talking about this at the level of structure, but maybe we're sort of smuggling in some of this paternalism with some of the language we're using. For example, Harriet Washington talks about trust as being somewhat problematic and blame the victim. So even whilst we're aspiring to talk about this in terms of the structural determinants of health, are we kind of resorting to this like individualized victim blaming approach that might stand in the way of actually getting on top of some of these problems?
I can
I
jump
just
in
want to
and
make
then
sure.
yeah, go
No,
ahead,
you go
Mark.
first. No, you go first. I think I'm just trying to grapple if I understand the question.
Okay, I think it's a great question for you, but let me maybe make one small comment before I pass it back. I think maybe what we are saying, and time is brief, so some of this is perhaps getting a little compressed. Maybe what we are saying is, for example, um, if our aim is really to promote, a more educated public who are better able to fit their decision making and their like healthcare seeking practices to, what is understood to be correct scientifically. If that's our aim, to give people the tools to access evidence-based scientific medicine, then maybe instead of trying to fact check like an individual social media post, correcting information for social media users one at a time, we need to, as Marco suggested, look more upstream and say, like, where are all these individually misleading or misinformative social media posts coming from in the first place? What kinds of structural interventions might make it less the case that everybody's like drowning in a sea of, you know, poorly framed or misleading or disinforming content? I wonder if
Maybe
that starts to kind of get it,
Yeah.
the distinction.
I was going to say maybe a sharper way to frame the question to you, Marco, is to sort of say, is there an unavoidable conflict between endowing individuals with a sense of agency and empowerment and at the same time entreating them to trust the evidence and seek the counsel of experts? Is there a world where um, as researchers or policymakers, both of those things can be promoted, or is there a sort of moral tragedy in recognizing that there is a trade-off between those two ideals?
Honestly, that's a really good question and one I'm going to be thinking about all day. I would say still, maybe just to echo Martha's comments, because I think I agree with those. It's more about just the production of information environments and how that interacts with agencies is probably something else that maybe I'm not as qualified to comment on. But I also would say, promoting things like consumer protections, medical disinformation and misinformation is a whole other thing as well than versus like public health mis and disinformation. When we're sick, we don't evaluate information the same way we do when we're not ill or we don't identify as ill. And that's the reason why there's protections in place about, pharmaceutical marketing for most of the world. So, I think there's these more informational environment questions. And then within those informational environments, of course, people are going to have their own agency, make their own decisions. But I think that information environment is at the moment not somewhere where I would say people are probably having the best agency anyway, because again, I think they're being met by a lot of deceptive messaging.
That's a great point. Can I throw in an example before we move ahead? Okay, so in my Instagram sample, I recently encountered a curious account that was pushed to me by the algorithm of an elderly Amish lady who is speaking about, for example, like all of the foods she doesn't feed her 12 children, supposedly. And there's something a little bit funny about the account. And as I interacted with it further, I realized this is AI generated. Because, of course, Amish people do not use electricity in the first place. There would be no such person, reasonably enough. And the account's purpose is really just to sell a supplement that supposedly detoxifies the body from microplastics, and it's quite expensive. So I was like ruminating about this, like, quirk in the Instagram algorithm when earlier this week the New York Times ran a story about its existence, which was like a funny surprise. And they revealed that not only is this account the work of a 28-year-old MBA student in Singapore, but
Mhm.
also there's new pending legislation such that in some states, including California, where I live, AI content will have to be labeled. So Instagram users will see what is and is not, like a real human being selling them a product. Um, so if we do not put in place certain kinds of checks like that on platforms, then it really is up to the individual user to discern whether or not they're interacting with like an authentic human being or something that's been mass produced by generative AI tools. And so
Yeah.
as Marco suggests, I think that that is another way of degrading the agency of individuals who are seeking information about health, right? So it makes sense to me that we should not be just kind of left to our own devices on social media platforms in that way.
I think this is a nice moment to kind of pick up this question about exactly how is artificial intelligence changing the misinformation and disinformation landscape. This is one coming from an attendee. Sort of on the one hand, you know, you could say that generative AI is kind of just producing content faster, cheaper. There's more of it. It's harder to moderate. But on another reading, maybe it's doing something qualitatively different, sort of dissolving the link between a claim and a human source. So I'm just kind of curious for Martha and Marco's reactions to that. Sort of how do you see AI kind of changing the landscape of mis and disinformation?
Yeah, I have strong feelings about this because we're currently involved in a struggle at my university system against the blanket adoption of ChatGPT by all of the Cal State colleges, which I think is an unfortunate trend in higher education in this country. I've come to see generative AI as maybe inherently, intrinsically anti-democratic technology, just because, among other things, it requires so much private capital and so much primitive accumulation or theft of intellectual property from authors and other creative people in order to train the models that makes generative AI run in the first place. And so I think there's something really nefarious about the entry of this content into um, medicine, into public health, both in informational settings, in online conversations, and also in medicine proper.
Yeah, I think those are fantastic points. The only thing I would add on is, I think sometimes we talk about AI, the risks are that we're just exposed to it, like on social media or something like that. There's a much more active element in this as well in information seeking. So like if you Google something right now, and you get like a little AI summary from Gemini, that is kind of, showing how some of this distortion is happening, where it's just the top performing content essentially becomes the expertise for these questions, which can be very sensitive sometimes. It can be political sometimes. And I do worry as well that there is a bit of a um, like uh, almost like too much of an American perspective on expertise when it comes to Gemini and the results that we get from those searches, but also from like ChatGPT and these other chatbots. We're doing a study right now where we're trying to use different locations around the world running the same queries, seeing if, country-specific resources come up, and it doesn't happen. It's usually focused is still on American content, which is a bit concerning just with what's happening with the US right now and the health secretary and all of the things that Martha was alluding to about like the MAHA agenda, what's going to happen with vaccines, in the future. I think that's a bigger concern to me is the production of expertise and how AI is kind of reimagining this, especially for folks who don't work in research, who don't work in medicine. Huge concern. But I also think, AI, just as Martha said, I think we're still going to grapple with what it looks like. We're going to see like, a whole flow of just kind of slop. Um, Hopefully like this AI bubble pops one day and then the actual good uses of AI we could adopt. But who knows? I think anybody who's saying they know what's going to happen doesn't know what's going to happen. I think it's something that's going to play out.
Actually, I'm conscious we're going to have to wrap up relatively soon, and I apologize in advance to all the participants whose questions we haven't got to. I'm going to pick up last on Emily Ragos's question, because I think it ties in quite nicely, Marco, to what you were talking about in terms of sort of the relationship, the US cultural dominance in this area. And, Emily observes that a lot of the accounts in this ecosystem are kind of often right coded, although, again, Martha, you might want to add some complexity to that. Um, and yeah, she's asking about whether this kind of influencer to government pipeline in the US is sort of helping to export right-wing health politics to other countries. And is there also something about the social media form itself as short, very digestible, easy to consume that makes this content particularly well suited to right-wing mobilization? Or is that just where the money and platform incentives are pointing to right now?
Those are wonderful questions. And hi, Emily. It's so nice to see you in the virtual setting. I think that I think it's probably correct to say that a lot of this material is right coded. I'm trying to think of like a great example of a progressive online health or wellness influencer, and I cannot come up with one off the top of my head. I think they probably do exist, but my sense is that they would be more niche. Um, yeah, I think there may be some natural affinities, interestingly, between left concerns and right messages currently. There's like a funny way in which the political spectrum is being reorganized in conversations about health and wellness in the US right now. I'm not so sure that this is happening elsewhere in the world, but currently the MAHA movement, I think, is getting a lot of its traction and juice from appropriating questions that historically have been asked on the left about, for example, why does the pharmaceutical industry have so much power? Why is our food supply so industrial? Why are we exposed to dangerous chemicals and toxins in our workplaces? Those are historically progressive questions that have been systemically, institutionally unanswered for the most part. But what traction we've gotten on those questions in this country has been from left movements. Maha is now cleverly doing an end run around those concerns and picking up lots of people who don't have strong ideological orientation, maybe, and pulling them all over into the Trump project. So that is really, really clever and effective of them to pick up again on some of the failings, the institutional failings of public health and medicine, and capitalize on them. Um, As to whether social media lends itself, for its format or its formal qualities to right-wing messaging, maybe it's a really good question. In other subject matter areas, there are wonderful, I think, like really effective users of the media. I'm thinking of Hassan Piker, for example, who's like a very left-leaning live streamer, social media user in the US, really good at the medium. I don't think that those media necessarily lend themselves completely to conservatives, but conservatives certainly know how to use them, especially in the current moment. Marco?
Yeah, I would say this is more about those groups, just if I'm honest, being really good communicators of their message versus the medium itself. I think they're more organized. I think their networks are quite established. There's a bit of a pipeline almost of kind of like far right or more right social media personalities that interact heavily with different kinds of alternative news outlets. So I don't know if it's necessarily the actual digital platforms, but I do think the digital platforms give them the affordances to amplify in some pretty powerful ways.
I'm just going to close by asking one final question. Is there any emerging work? We know that kind of out educating, pre-bunking and debunking often are ineffective. What are some of the kind of what's some of innovative new work that is coming to the fore that shows what does work to kind of de-radicalize people, to kind of detach them from their attachment to some of the ideas that are circulating? What are you both seeing that's emerging, that's working, or at least that you feel has the prospect of working, even if the evidence isn't there yet?
So I guess just a couple of things. And I say these at the end of like basically any talk I give. So sorry if this is more of a blanket statement. Protect journalism, expand journalism, protect it at all costs, stop predatory journals in the research space. I think that's somewhere we can make some gains. Uh, you know, Try to fight inequities as much as we can for the right reasons. Promote consumer protections, rein in digital platforms, and be honest about our shortcomings. Um, on an individual level, I'm not sure I have too much more to add, but I think we should just disrupt the incentive for disinformation as much as possible, make it as hard as possible to make money from spreading disinformation.
I can't add to that. It's a great list, Marco. That's really, really helpful and clarifying, I think. And I would just note that the way you communicate those points in itself is really such a nice model of the kinds of translational public health communication that I think can and should be effective.
Well, thank you both so much, and thank you to everyone for participating this afternoon. I'm sorry that we don't have time to unpick all of the rich threads of this conversation. I think what's really stood out to me today is that there's a lot of productive tension in what we're discussing, the necessity for trust and accompaniment without veering into paternalism or ascriptions of false consciousness, the necessity to adopt a more humane and compassionate view of mis and disinformation whilst continuing to be dogged and relentless in combating it. And I think there's this interesting tension that Ruth Muller alluded to in her question about, the where mainstream medicine ends and wellness culture begins. And I guess just the general reminder that the boundary between good and bad information is not as clean as we might like in many instances. So Marco and Martha, thank you both for your very astute and unflinching and nuanced contributions to this conversation. I feel like I've learned a lot and very grateful for your contributions. And thank you all for being here. And of course, thanks to the Brocher Foundation for having us.
Thank you so much.
Thanks for having us.
Thank you, everyone. Bye-bye.
Bye.